Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about why nerves malfunction. So we've been talking about peripheral neuropathy for now 124 days. This is day 124, and people are still asking, people are still wondering why the nerve is malfunctioning instead of just stopping to function. So let me give you kind of a wide view of what's going on. So the idea, when a nerve malfunctions, it's going to be one of three things. It's going to either be a weak signal, a slow signal, or a signal that can't be recognized, an erroneous signal. That being said, there also is a fourth type, which is no signal. So if a nerve cell is dead, it stops sending signals. If you cut the spinal cord, for example, you stop getting signals. So that's the fourth type. But in most cases, in most peripheral neuropathy, you're gonna have one of the other three, where it's an erroneous signal, a weak signal, or a slow signal. So we talked about nerve fibers yesterday, and we actually talked about that you have nerves that are large and small, and the larger nerves, of course, have a myelin sheath. If you lose the myelin sheath, you slow down the signal, and you get a weak or slow signal in those cases. If you have inappropriate nutrients, insufficient nutrients, then you may still be making things, may be trying to create the neurotransmitters, you may be trying to create the proteins and enzymes that communicate between the different cells. But because of insufficient nutrients to do it, there may be less there should be. And because of that, you may have a weak signal, or you may have an erroneous signal where it's sending a signal, but it's not sending what you're expecting, because the body is designed to try to heal itself. And so it's going to try to function. It's going to try to say, well, let's see if I can make it work. Let's see if I can MacGyver it to make it so it's supposed to function like it's supposed to. And so it may use different signals or different enzymes to do what it's supposed to be doing, and it won't send it exactly right. And so then the other nerves or the brain itself will be unable to interpret it, and it will get an erroneous signal. So you'll get a light touch on your foot, and it causes severe pain, say a sheet or something like that. And that's because it's not that you're not getting a signal, you're not getting the correct signal. So nerves are malfunctioning because the body is designed to try to function. And so if anything is injured or damaged, it's not going to function exactly like it should. So in most cases, like we said, peripheral neuropathy is a malfunction, not a loss of function. So that being said, as you move forward, as you're trying to do what you need to do, you should be looking at what are the causes of these malfunctions, because if you can fix the cause, the malfunction goes away. If you're able to heal the myelin sheath and it repairs itself, the speed will increase again, and the nerve is no longer weak or no longer slow. If you improve the nutrients levels by taking the appropriate vitamins, then you're now creating the appropriate enzymes, proteins, and neurotransmitters to continue to function like you're supposed to. So understanding the cause can help you also fix the malfunction. And there are even studies showing that it may even fix small sensory nerve fibers that are absent, because they will start to regrow. This is Dr. Brandt Gibson, and this is your